welcome everyone. Thank you for joining us. My name is Brittany Quemby and I am the Managing Marketing Director here at HITMC. And I am here today with Goel Jasper, who is the Managing Partner and Digital Health Innovation Lead at Fin Partners. Welcome, Goel. Thank you for being here with us today.
Thanks, Brittany. This is great, and I'm really looking forward to it.
So for those of you who don't know, in May we held our 2021 Medigy HITMC Awards, and Goel was our winner for Marketer of the Year at an agency. So congratulations again on your win.
Thank you.
And we just wanted to sit down with Goel because he's done some pretty interesting things, not just only this past year, but in his career in general. So we wanted to just sit down and get a little peek behind the curtain on everything that Goel has done in the past several years. So I'm going to dive right into our questions. Well, maybe you can tell the community a little bit about yourself, and in HITMC fashion, we do like everybody to share a fun fact about themselves. So I'll head it over to you.
Okay. Even though I'm based here in Israel, I actually grew up in the States and spent the first 33 years of my life there. I grew up in Philadelphia. I'm still a big Philadelphia sports fan, which is kind of tough sometimes when in order to watch a game, you have to wake up at 3 o'clock in the morning. But a fun fact about me, I don't know, I have 8 children. Is that fun?
Wow, I mean, that is a feat for sure.
Yeah, I have 8 children. My oldest is 24 and my youngest is 11. And our house is, like, figuratively and literally a barrel of monkeys.
I can imagine. I feel like that with 1, so I cannot imagine 8.
It's a lot of fun.
Wow. Thank you for that. And so, you mentioned you're in Israel. You're part of the Fin Partners Israel office, the Jerusalem office. Can you share with us a little bit about your role there?
Sure. Like I said, I didn't live in Israel until I was already 33 years old. By then, I had a pretty strong background working on both the agency and client side in the States, mostly with technology. And my most recent position before moving to Israel was as the head of communication for Ciena Corporation, which is a pretty large optical networking telecom equipment manufacturer. Because of that experience in the States with both the agency and client side, I really was fortunate enough to have a pretty well-rounded experience in PR and marketing before moving to Israel. Israel is an incredible place of innovation. And the Israeli government is not paying me to say that. Like it actually really is an amazing place of innovation. I think probably most of the people who are watching this have heard about Israel and its innovation. And one thing that Israel is not traditionally strong at is the marketing of that innovation. And so the Israeli mentality tends to be, I invented this amazing technology that can impact the world in a tremendous way. Of course, everyone's going to fall all over themselves begging me to buy it from me. And as you know, that's not the way the world works. And it's in particular, it's not the way the health ecosystem works. And so having the background I had really came in handy. I had no idea what I was going to be doing when I moved to Israel. We moved to Israel for ideological reasons, not for business reasons. But it's certainly gone pretty well for me here business-wise. And I think that the reason it has is because of that background that I had from the States. In terms of what I do here and what we do here, I have 25 people here, and we focus on exactly what you would expect given the background I just walked through, which is we help Israeli innovators in the area of health communicate to the world. And they appreciate us because in many cases, we have to first educate them about how complicated the US health ecosystem is, how fragmented the system is, and only then do we start putting together a marketing plan and implementing for them. So we have the opportunity to be real partners with these companies, and that's obviously gratifying and fulfilling. And so we're fortunate.
That's awesome. And, probably great for these companies as well, who, like you said, have this technology or this great idea that they want to get to the forefront, but maybe, lacking in or maybe not lacking, but, may not have as much skills as you guys would to be able to get it out to the audience. So I'm sure they're probably grateful for that as well. And, you talk a little bit about, some of the companies that you worked with and some of the clients, but, you do a lot of work with MedTech startups and kind of getting them to the forefront. So maybe you can share a little bit about the process that you work with them on.
Sure. Like I said before, this is a country of innovation, no question about it, but very often the CEOs of MedTech startups have a background in classic high tech. And maybe they had a family member that had a challenging experience with health or with treatment or wellness or whatever it might be. And so they take on a challenge in the world of MedTech, banking on their high tech experience to carry the day. And so what they really depend on us for is to help them navigate the US system from a communication perspective. And so they're used to the paradigm of, okay, who's the customer? Who's going to buy this product? And let's make sure that we create messages and wind up communicating on the platforms and in the media outlets that matter to those customers. That's their understanding of how marketing works. And so we, as I said before, we educate them about the US health system. And we, in essence, for any client, we wind up developing several communication plans. So we may have a communication plan that's focused strictly on payers, insurance companies, Medicare, Medicaid. And we may, for the same client, put together a communication plan focused on physicians, other clinicians, nurses, pharmacists, anyone from the provider community. And so we a long time ago, what's a long time ago? Maybe 4 or 5 years ago, we realized that our role as a PR agency is done. We don't do that anymore. What we do is we serve as the communication arm for these companies, because startups don't have the budgets to justify internal communications professionals. Right. Some of them might be able to justify a VP of marketing, but not all of them. Very often we're dealing directly with the CEO. And so that CEO, he or she will depend on us to be their voice and the brains behind their voice for communicating to the markets that matter to them.
Mm-hmm. Yeah, and you bring up a good point, because I think even startups here in North America too, you don't necessarily have the budget to get those strategists in or a communicator in, or it's typically one marketing person, and then the messages that you do create are that kind of blanketed approach, as you mentioned, kind of a one size fits all, but as we all know, as we go into the healthcare space, that doesn't always work. And you do need to do that segmented approach to be able to get, the eyeballs on your messages. So
exactly. By the way, I also want to say that working with startups is an absolute pleasure, because they move fast.
Oh,
if we come up with a concept for some kind of campaign, the ladder that idea has to be going up at the client company is a pretty short ladder. It's right. Like one, maybe two people, and then boom, you're going. And so one of the things that I really appreciate about the other members of my team is that they're so nimble, and there's so much energy, and that comes from the fact that we're working with startups. So like anything in life, you have the challenging side of startups, which is that they have a sort of simplistic view of things. And then you also have the invigorating side, which is they love moving fast.
Yeah, definitely. And, I've worked at startups and both large companies. And I remember, someone had said this analogy to me that, as a startup, you're basically operating like a speedboat because you are going so fast. Things get, decided very quickly. It can move up the chain very quickly. You can be nimble and change from and pivot from one decision to a next. When I went to a bigger company, they said, yeah, it's more of like a barge or a cruise ship. So like pivoting is really hard to do, and it takes a lot of time for things to, get in motion. So I agree with you 100% on that. The startup mentality is such a fun and invigorating place to work in, right?
For sure, for sure.
And you talk about educating the clients and partnering with them to to really try to educate them on how to communicate into different segments and into the industry. And I read that you recently, and not sure the date of when this happened, but that you developed a global training program for employees and have or for your colleagues, and have actually mentored a number of your colleagues in many different countries and states. So maybe you can talk about the education process there and maybe how it's different from educating clients.
Sure. First of all, I want to give I don't know if this is a phrase, but I want to give collaborative credit to one of my colleagues, Goel Jasper, who and I'm sure many of the people watching know Gil. He and I came up with this concept together because the Jerusalem office before 6-7 years ago was focused primarily on high tech, and we were able to pivot so, I don't want to say easily, but so smoothly to health innovation. We realize that this is a pivot that is replicable in other markets. There are other markets around the world. Some of them are obvious to you. San Francisco, for example. Singapore is another example. Markets that are sort of innovation-based. And the idea we came up with was maybe if we can help them understand how smooth the transition can be from high tech to med tech or health innovation, that they also would be able to play the same kind of role, helping startups in their startup economies to communicate to the world about their innovations. And of course, the concept had its basis in trying to grow our business, but man, one of the most incredible benefits of working in health innovation is that every day we're working on technologies that can save lives, extend lives, make a difference to people, and that's it's not just rewarding, but it's exciting for my team. And so we thought, with such a great product, that product being health innovation and what it means for the world, we could educate other members of the Fin network of our brothers and sisters in other cities and countries to do what we had been doing. And so we identified those markets, and we started with San Francisco, and actually it was San Francisco, Portland, and Los Angeles. And there were about maybe 40 participants, and we just created a curriculum, a 6-session curriculum. You'll love this. The first session was let's show you how similar health innovation marketing and communication is to high-tech communication and marketing. So that, from the very beginning, we would show them, don't worry, there's nothing to be afraid of here. It's actually quite similar. And then, of course, we went through the differences as well. And one of the differences, and this was a key component of the program, which we then also did in Singapore and also for our global integrated marketing / digital team, was those sort of landmines that you have in the world of health that you don't have in classic high tech, principally issues related to regulation and claims and what the label says versus what you're allowed to talk about and those kinds of things, and the importance of science, the importance of studies to back up what you're talking about. And so it, on the one hand, showed them that it's an area that's not too far of a departure from what they're doing, and on the other hand, demonstrated to them that it is acceptable to be a little humble about entering into this world, because it's a world where you have to communicate enthusiastically but carefully, so that you're not overstepping. It's been a great program. I'd say overall over 150 people have been trained.
Wow.
Yeah,
that's brilliant. And I mean, and such a great, idea or collaborative idea to be able to, take what, we quite often we don't necessarily see, see it this way, but take what works and then replicate it, into different markets where, we know it'll also be successful. So such a brilliant idea there. And, we kind of talk about, pivoting and, being able to, change. This past year we've probably had to change, many of our ways of, marketing or communicating to audiences. And I read that you has recently co-chaired the Finn Health Practice Global Virtual Summit. And we've done a bunch of virtual summits ourselves, or not summits, but virtual events this past year. And I'm just curious, and I think a lot of people are curious of, if you could share your recent experience and, any tips that you have, because I think what we're realizing is this hybrid model of maybe a little bit in person and virtual is going to be, here with us for quite some time. We even see it at HIMSS coming up, and some of the other, big health conferences are coming up. So maybe you have a little bit of advice or tips you can share based on your experience as co-chair.
Great. Yeah, I co-chaired it with Christy Kuhl, who was just named as Gil's successor as the head of the health practice at Finn. Right. And I cannot imagine a better person and stronger professional to be that in that new role. I just think the world of Christy. So I'll tell you what we did as an illustration for sort of the philosophy behind it. I think that's more interesting than talking about the philosophy and then the implementation. We developed we normally about every 18 months, the whole health practice gets together to talk about where we are and where we're going and those kinds of things. And so the initial thought was, okay, so we'll do that, but we'll do it virtually. Now the issue with it is that normally that kind of event, which is done in person, has sessions that vary in length from somewhere between 40 minutes to an hour. And so Christy and I said, let's do something different. Let's create a summit that's like an episode of Saturday Night Live, where we'll have skits and monologues and commercials, and that will be the event. And we'll do it 2 days, 2 hours each day, with no session more than, I think it was no session more than like 10 minutes or something. I mean, it was like really, really rapid fire. Just, and now we'll get into the philosophy with the thinking that everyone's just on Zoom all day, and the last thing they want is to have to sit through 4 hours a day for 2 days of just droning on. And so the monologues were people talking about certain areas of expertise, but again, very quick. The skits were certain games and other features to help people get educated and learn about certain things. And then the commercials were 90-second case studies from different clients we work with. That we, the members of the team who work on those clients develop those case studies, those video case studies for this event. And so it was like we'd have a session, and then the session would end just like on Saturday Night Live. The skit ends, and then in comes the commercial. And of course, on Saturday Night Live, you never know when it's a real commercial and when it's a fake commercial until you're into the commercial. But in this case, obviously, there were no real commercials. And so everyone would just wait for the commercial to run, and then we'd come back from the commercial, and they would see Christy and me, and we would say welcome back. And it was a terrific event. and demonstrated that a little creativity, and I do mean a little creativity. I don't want you to think that this was any kind of genius thing. A little creativity goes a long way, especially, and this is all what marketing is all about, especially when you're sensitive to how the human mind thinks. And we knew what our audience was, and we tailored it toward what would work best for our audience.
Yeah, that's great. And you're so right in terms of I think everybody, even during the the height of the pandemic last year, was very probably burnt out. And even probably before then, people didn't maybe want to sit for 4 hours in front of their TV. I think COVID maybe brought that to the forefront, but I think even before, people were like, don't think I want to be on there for 4 hours just listening to someone, talk at me.
Right. And I have to say, you guys followed that rule also with HITMC Awards. Like, it was rapid fire also. It was really good. Nothing was on that screen for too long. No one was on the screen for too long. It kept moving, and I think it kept people engaged.
Yeah, and I think we had the same philosophy in terms of we had done a number of virtual events previously in the year, which were probably a little bit longer than they probably needed to be. But I think as we saw people begin to experience that burnout, you have to again pivot to make sure that you're keeping them engaged. What are ways that we can keep them engaged and do it in a fun way where they're not leaving saying, well, that was a waste of time, or that was boring. That's not that's the last thing that we want. So we definitely had that in mind as we were creating the agenda for that. And we talk about recent recent projects we talked about past projects, but I'm interested in terms of are there any recent projects that you're getting excited about this year as we're kind of moving, I guess, not somewhat away from the pandemic, but into maybe some different waters? Are there any projects that you're really excited about?
I certainly don't want to use this conversation as a way of talking about specific companies and how they're going to be the greatest companies in the history of the world. But I will tell you that working in a market that's innovation focused is pretty darn amazing from the perspective of just seeing these things that you would think are science fiction. It's unbelievable when you have these amazing minds putting their energy toward health innovation. We see amazing things. I'm particularly interested in, we have two clients, again, I'm not going to mention their names, but they're both in the area of behavioral science, which some would say is sort of the next frontier for AI. Understanding not just how we can use data to sort of see things and predict things, but also how we can use that to impact people's behavior in a real way, and understand, in fact, for one of the companies, we refer to it as behavioral understanding, and understand what people are really driven by, and make the most of that understanding for the sake of helping that person, rather than for the sake of selling to that person, which has been the world of advertising for decades. And so it's just exciting to me when you can see a technology that can help diabetics take the proper steps, both literally and figuratively, toward leading healthier lives, and working, so to speak, around that person's preferences and schedules and challenges and demands. And so behavioral science is particularly exciting, and we're just embarking on a couple of projects in that area right now.
Yeah, and you said it great. It must be such an exciting thing to be a part of. Seeing these technologies, from the birth, and then them grow and what they can actually do for the greater population and lives and behaviors. It's transformative, right?
Yeah, and also I think in our business, all of us, the more we can get jazzed about the subject matter, the better job we're going to do. And so when the subject matter is like, wow, this is going to change everything in the world of oncology, for example. It's so much easier to be excited about it, and we wind up doing a better job. So everybody wins.
Definitely. Well, and speaking about exciting things, I would be amiss to not talk about your award. I always ask everybody this question. So, Goel, you were our winner for Marketer of the Year at an agency. I always love to know how people felt and what it was like to win the award. So if you can share a little bit about that with our listeners.
Sure, with pleasure, and I hope I don't get choked up. Because it was pretty remarkable. The fact that it was a virtual event and this particular award came toward the end, which I didn't know in advance, by the way, meant that I sat and listened to the entire thing and enjoyed the entire thing. And if you can picture this, just because of the relative strength of Wi-Fi in different areas of our house, I was sitting at the desk in my 19-year-old daughter's bedroom. So I was at the desk looking all handsome and neat, and my wife was sitting on my daughter's bed, just sort of listening in and maybe reading a book or whatever. And then when it came time for my category, I looked at the screen and I saw some bullet points that sort of sounded familiar. And you guys hadn't turned the camera to me yet, but I wasn't sure when you would. So I'm like, almost like a ventriloquist. I'm trying to like talk without moving my mouth. And I'm like, Gila, I think I won. I think I won. I think they're talking about me. And then sure enough, it happened. And you know, it's amazing. When it was clear that it was me, the first thing that came to mind, and I apologize if this sounds cliche, the first thing that came to mind was all the other people at Finn Partners who are so great and who put me in this position, both people above me and people who are not yet at my level, all put me in a position to be able to win this. And so I know it sounds trite, but like it's everybody at Finn who won this thing, and I get the trophy, which is kind of cool. But it was that is literally how the whole thing played out, and it was just amazing.
Oh. And that makes me so happy. I love picturing you in your daughter's room with your wife beside you and you on the bed. It's just such a you know, a sweet moment to picture. So thank you for sharing that with us.
Yeah, it was great. It was great.
And you get to, you know, it was kind of a year for Finn as well. You know, we had, I just spoke with Helen Skelton last week about the Hip Hop Public Health Award, and Finn, you know, winning, you know, multiple awards this year. So, you know, kudos
Vanderbilt as well.
Yeah, and yes, and Vanderbilt's as well. So kudos, you know, to you guys. And so, you know, let's talk a little bit about Finn Partners for a second. You know, we kind of talked about what, you know, some of the work that you're doing, but what gets you most excited, you know, about working for a company like Finn Partners?
Wow. Okay. It's a great question, and given the fact that Finn Partners is now almost 900 people and 20 offices around the world, it may not be something that's easy to believe, but given the fact that Peter Finn, the founder of the company, is still with the company and not interested in selling to you know, one of the global advertising conglomerates, there's a very sort of comfortable, family, homey kind of feel here. One of his stated values is that at Finn we work hard and play nice, and that's really true. We leave money on the table for the sake of providing our teams with a great work environment, working with clients who are not only doing incredible things but are also really nice people and good people. And that to me is the special sort of fingerprint of Finn Partners. Yes, we do great work. Yes, we're innovative in terms of marketing programs and creativity and all that stuff. Sure, we do it all. But being able to walk into the office in the morning and genuinely care about our colleagues, that's what's really special.
Yeah, and I think, you know,
come work with us.
Yeah.
Well, join the Jerusalem office.
Yeah, seriously. I mean, I'll get on a flight, right? But you know, it's so important because, you know, you can you can do great work, but if you don't align with the values of a company, what's worth, is it really worth working with a company that you don't, align in the values, and you don't love getting up and going to work in the morning? I think quite often, people just stay in companies because, they do great work or for the namesake, but if you're really not aligning on values, for me personally, that's just not something, I'm willing to,
Compromise on.
to compromise on. Exactly.
Yeah,
exactly.
I'm with you.
So, you have done quite a bit in your career. We've talked a lot about it, and you've been with the company for several years, and you've kind of had to build things from the ground up with the Jerusalem office. Maybe not quite on your own, but you put a heavy load on your back. So I'm wondering, for folks who are listening who might be in the same role, or a marketing leader who has those same goals they need to reach, what would be some advice to them on either how to get started or how to keep it all going or move it forward?
I think there are probably three elements. There are certainly two. There might be three. Element number one, and I think we talked about this earlier, is you've got to be passionate about the subject matter. We don't work for clients unless we are jazzed about what they're doing. We just won't take it on, and that's part of the work hard, play nice philosophy that I talked about earlier. If we can't be genuinely excited about something, great. So they're paying you money. Okay, it's nice. It's nice to get paid, but it's not enough. It's not enough. When you're a marketer, you need to be passionate and energetic about what you're doing, and the clients need to see that passion. And so that's element number one. Element number two, and this is an element that I've been working on a lot recently with a couple of my colleagues, is the question of measurement of the work we do. It's sort of like the classic question in the world of marketing: how do you measure the value? And we're actually in the process right now. This is coming from the Israel office. We're in the process of developing a new way of measuring the impact of the work we're doing. Because as you know, when it comes to marketing, normally measurement has to do with, if it's PR, number of articles and the sentiment in the articles, and other areas of marketing communications. Maybe it's, visits to the website, lead generation, and those kinds of things. But often it will also just be measurements of process. How many news releases did we send out in this quarter? And how many followers do we have on Twitter now? How many likes did we have for that LinkedIn post? But those measurements are not impact measurements. Those are process measurements. And so I think the more that people in the world of marketing, particularly when you're talking about health, because we're not just trying to sell more computer mice or bars of soap here, we're trying to change people's lives and save people's lives. We have to be focused when it comes to measurement on impact. And sometimes the harsh truth can come out when you're focused on impact. We got an article in the Wall Street Journal, but interestingly, because the article was behind a paywall, no one read it online. And so how much of an impact was it? Meanwhile, we got something in like Moby Health News, everyone is able to see it. And lo and behold, a piece in Moby Health News becomes more valuable than a piece in the Wall Street Journal. I'm not saying that's necessarily the case. I'm just giving a little example of the importance of impact measurement versus process measurement. And so that's the second area I think we should all be focused on. And the third area, and this won't come as a surprise at all, the third area is always challenging how we've done things in the past. We must always challenge things. And just because we've done it until now doesn't mean we should keep doing it. One example is, for every client, traditionally we send news releases out on PR Newswire, Business Wire, Market Wire, all those. And then we also have our own list of contacts that we send it to. So more recently, we've asked the question, like, is it really necessary to send it out on the wire? Now, for public companies,
right.
it's different because there's disclosure responsibilities and requirements. But for startups, maybe they can save that money and put it toward Google ads or other paid campaigns with digital platforms. So the third one is to always challenge how we do things.
And I mean, those such great tips as you're saying them, I'm thinking, yeah, that's such a great idea. And especially the third one. And, I think a lot of companies and even probably a lot of our listeners are, some of them are small marketing teams or small companies who might not necessarily have the capability of doing those big business wire, market wire. So to be able to challenge yourself to use your network or your Rolodex per se of people to help you get your message out there is such a great piece of advice.
Yeah, there are companies that come to us and they say, we have like $2,000 a month we want to spend on an agency, and of course that's too low.
Right.
So I say to them, don't look for an agency. Just do some social media boosted posts and Google ads. Those products work really well. Right. So maybe you won't be a Fin Partners client right now, but at least Fin Partners is helping you to do what you should be doing if you have that small a budget.
Right. And maybe one day
they will be.
Yeah. Well, Goel, we're nearing the end of our conversation. And so I'd like to end, most interviews with a similar question, but I think we've all experienced an interesting year, I guess year and a half, coming on 18 months this past year. What is one of the most valuable things that you learned this past year that you can share with our listeners today?
I'm not sure this is the answer you're looking for, but what I've learned during this past year, and obviously at this point it's more than a year, since the pandemic began, but I understand the award is for this year, so we'll say in this 12 months. What I've learned is people are amazing. People are amazing, and humanity is wonderful, and we have to be so appreciative of all the good in the world. There's a tendency because of social media to focus on what's not good, but man, there is so much good in this world, and we in the area of health have the opportunity to improve upon that and to help people. And during this last year, there are so many people doing so many good things for so many other people. We really need to be appreciative, and I am appreciative.
Awesome. Well, what a good way to end our conversation, because I couldn't agree with you more. And, I think if we can highlight those good things even more, we have to. So thank you for sharing that with us. Well, everybody, we are done our conversation for today. I want to thank again Goel Jasper for being here with us and sharing a little bit about what he's doing at Fin Partners and what he's been up to this past year. So Goel, thank you so much again for being here with us today.
My pleasure, and I'd be happy to have any conversations with anyone. If you need advice or you want to talk about the work we do and the work you do, I'm more than available.
Great, thank you for that. And hopefully one day we can meet in person, Goel. Maybe not this year, but maybe next year.
Sounds great. Looking forward. It'll happen. Yeah,
one day, right?
Absolutely.
Well, thank you so much. This has been Brittany Quimby with HITMC. Thank you, everybody, for listening.